Hey everyone, Dr. Mike here. Today we're diving into the most common side effects you can expect from the brand new 2024 COVID vaccine. We're going to break down those common side effects, what causes them, and what you can do to manage any discomfort. So if you're ready to become a vaccine side effect pro, keep watching. Let's start with the most common side effect, the sore arm. It's something almost everyone experiences after getting vaccinated. It's your body's natural response to the injection. When the vaccine enters your body, it triggers your immune system to start working. The vaccine goes into your muscle and your immune system jumps into action, causing temporary inflammation at the injection site. This is a sign that your body is building protection. Most people describe it as a dull ache or tenderness, and it usually pops up within a few hours of getting the shot. This discomfort is a normal part of the process. The soreness is mild and goes away on its own within a day or two. It's a small price to pay for the protection the vaccine offers. Over-the-counter pain relievers can help, and gentle movement can reduce soreness. Stretching your arm and staying active can also alleviate the discomfort. Remember, everyone's body is different, but it's usually temporary and nothing to be overly concerned about. If the soreness persists or worsens, consult a healthcare professional for advice. Let's talk about fatigue. Feeling a little tired after getting the vaccine? Totally normal. Your body is working overtime, building up its defenses against COVID-19. This complex process requires energy, a lot of it. So it's no surprise that you might feel a bit drained for a day or two afterwards. Listen to your body and give it the rest it needs. Stay hydrated, eat nutritious foods, and maybe skip that intense workout for a day or two. Remember, fatigue is a common side effect, not a sign that you're actually sick with COVID-19. Now let's address those pesky headaches that some people experience after getting the vaccine. Headaches related to the COVID-19 vaccine are usually mild and temporary. Your immune system releases chemical messengers to rally the troops, which can temporarily affect your blood vessels and nerves, leading to headaches. Over-the-counter pain relievers are usually very effective. Make sure you're drinking plenty of water too, as dehydration can sometimes make headaches worse. And as always, if you're ever concerned about a headache or any other side effect, don't hesitate to reach out to your doctor. Let's talk about muscle aches. These aches can be a common experience for many, especially after certain activities or medical interventions. Muscle aches after the vaccine can be kind of similar to post-workout soreness. Just like how your muscles feel sore after a good workout, your body is responding to the vaccine in a similar way. Your immune system recognizes the vaccine components as potential threats and kicks into high gear, causing inflammation in the muscles. This is a sign that your body is building protection. These muscle aches are usually mild and short-lived, lasting only a day or two. It's a small price to pay for the protection the vaccine offers. Over-the-counter pain relievers can help ease any discomfort, and gentle stretching or light exercise can actually help reduce muscle soreness. Staying hydrated and getting plenty of rest can also aid in recovery. Remember, everyone's body is different, so while some people might feel like they just finished a tough workout, others might only experience very mild aches or none at all. It's important to listen to your body and take care of yourself during this time. Let's talk about fever. It's a common response of your body to various conditions, including infections and vaccinations. A mild fever after the COVID-19 vaccine is actually a good sign. It indicates that your body is responding to the vaccine and building protection against the virus. When your immune system detects the vaccine components, it releases pyrogens that tell your brain to raise your body temperature. This is a natural part of the immune response, helping your body to fight off potential infections. A fever after the COVID-19 vaccine is usually very mild and goes away on its own within a day or two. It's your body's way of saying that it's working hard to protect you. Drink plenty of fluids to stay hydrated, rest up, and give your body the time it needs to recover. Consider wearing light clothing to help your body regulate its temperature more effectively. Keeping cool can make you feel more comfortable. If you're ever concerned about a fever or any other side effect, don't hesitate to reach out to your doctor. They can provide guidance and reassurance, ensuring you stay healthy and informed. So, there you have it, a closer look at some of the most common side effects of the 2024 COVID vaccine. Remember, these side effects are generally mild and temporary. If you have any concerns, always consult with your healthcare provider. Stay safe and healthy, everyone.